New Brunswick Premier Susan Holt and Health Minister John Dornan say that recent stories about a makeshift healthcare unit in a converted ambulance bay in Fredericton's hospital are unacceptable, but are a symptom of a system bursting at the seams.
It's pretty hard to say that it's better than nothing because it is terrible. But the alternative right now is nothing, is no care, no place to lie your head down. So we're really in a bad place. There's no question.
The stories came to light through an open letter addressed to Holt, posted to social media by Katarina Leckborg, a registered nurse who says her 88-year-old grandmother spent days in what's known as the medical transition unit at the Dr. Everett Chalmers Hospital in Fredericton. In it, she writes that there is no bathroom, no running water, no sink to wash hands. She eats inches from the commode she must use to relieve herself. There is no privacy, a tattered curtain with holes.
This is appalling, an appalling situation. It's a garage where they've set up these little cubicles with curtains in front of them to house a stretcher or in some cases actual beds, I suppose, with a chair. That's all that fits in there.
Dornan says the unit has existed for about a year and started as a temporary measure due to overcrowding. Over a third of Horizon's acute care beds are regularly occupied by alternative level of care or ALC patients, people who have been medically discharged but are unable to return home and are waiting for a long-term care bed. That means backlogs throughout the rest of the hospital system and makeshift units like the MTU.
What we need to do is be able to get those folks back into a proper emergency department, and we do that by getting people that are there, those boarded patients, up to the floor. We do that by relieving the ALC people that are on the floor and getting them out to the community. And we're working with Horizon and Vitalité so that people that are ALC patients do not need to be in a hospital but can't go home, can go to those empty nursing home beds.
The province released its Alzheimer's strategy on Thursday, which comes with $1 million for programming to help people get the help that they need. The head of the province's Alzheimer's Society says that the problems are intertwined. On any given day, 60 to 70% of ALC patients are people living with dementia.
When we look at who's living in those beds, because they are living there, it's months at a time for some people, they are people living with a diagnosis of dementia, either previous to coming into the hospital or receiving it upon being hospitalized. And so, this investment in community supports is meant to get ahead of that and to prevent that being the alternative for families.
In a statement, Horizon CEO called the overcrowding issues facing the health authority complex, but says that they are working across the system to try and get a handle on the problem.